Can a rhinoplasty improve someone's breathing?
Absolutely, that's one of the things that we do really great here. We will routinely address the septum, turbinates, and any nasal valve issue where people have collapsed, especially after they've had prior rhinoplasties that were over resected and made to really pinch in here. So we can often help address any kind of nasal breathing problems at the same time as their cosmetic rhinoplasty.
Can you explain to me what a septum is or a turbinate?
So the septum is the partition wall in between the two nostrils on the inside of the nose. Sometimes you're either born with it this way or it was related to trauma, but it can be twisted and that can obstruct the nasal breathing passage. The way I think about it is there are a couple things that can cause problems with breathing. One is allergies, which causes swelling of the side walls and also can inflame the turbinates, which we'll get to in a moment. With the septum is a fixed issue, which can cause obstruction. And if it's deviated in one way or another, where it's really blocking things off, then we can remove that roadblock to allow you to breathe better. The turbinates are natural structures, normal structures in the nose. We have 3 sets of them, so 1 on each side for inferior, middle, and superior, and they humidify the air. So we need them. Sometimes with allergens and inflammation, they can hypertrophy or thicken. So what we do is called submucous resection, which is basically doing almost like a liposuction procedure for the turbinate. You go inside it, very minimally invasive, shave away some tissue on the inside and then move it off to the side. The third thing that I mentioned was the nasal valve correction, and that's often a problem either native to the nose or related to prior surgery where patients have collapse of the nostrils, especially more of a dynamic problem when they breathe in and the nostrils collapse. And so I address that nasal valve by supporting it with cartilage, whether it's from the ear, from inside the nose, from the septum, to make good use of that material. It works very well to help preserve and improve the patient's breathing.